Dear students, now we will learn about the external features of the heart. The heart has four chambers. One is right ventricle, left ventricle, the right atrium, and the left atrium. The atria lies posterior and to the behind of the ventricles, and it lies above the ventricles, and the atrium and ventricles are separated by interventricular groove and by interatrial groove. The atria are separated from the ventricles by the atrioventricular groove or the coronary sulcus. Okay, now the coronary sulcus. The coronary sulcus or atrioventricular groove lies between the atrium and the ventricle. It has two parts. This is the anterior part and this is the posterior part. Okay, anterior part has right half and left half, and it initiation of the atrioventricular groove from the right auricle, in between the right auricle and right ventricle. This is oblique and just like this, and crosses towards the base, towards the diaphragmatic surface. Then it goes to the left. Okay, and in left it lies left part or anterior part of the atrioventricular groove. It lies between the left auricle and the left ventricle. Okay, now the interventricular groove, it has anterior interventricular groove and the posterior interventricular groove. Okay, the anterior interventricular groove encroaches towards the posterior interventricular groove and meets at the inferior border. Okay, now the interatrial groove. Interatrial groove, actually we cannot differentiate it very remarkably. Where is the interatrial groove? You have to examine it, and anteriorly the interatrial groove is not seen because of the presence of the ascending aorta and the pulmonary trunk. Okay, you have to also know that the atrioventricular groove is overlapped by the ascending aorta and pulmonary trunk anteriorly. Okay, now the surfaces and borders of the heart. Before this, I want to tell you about the apex, base, and apex and base. The apex is conical and it is solely formed by the left ventricle. It is very much important. That is entirely it is formed by the left ventricle. Okay, now the direction of the apex is downward, forwards, and to the left. Okay, its situation of the apex is very much important. It's situated about 9 cm lateral. In the left, you should say like this. That is, in the left fifth intercostal space, about 9 cm lateral from the midline, just medial to the mid-clavicular line. Okay, below the age of 2 years in a child, it actually lies in the left fourth intercostal space, and in the mid-clavicular line. In adult, it is just medial to the mid-clavicular line, but in child below 2 years, it is in the mid-clavicular line. Okay, it is very much important to see the apex bit. You will learn it in your clinical classes. Now, the base. Base actually formed by two atrium, and it is by this is the base. You will hold like this when you will be asked to show the base. This is the base, and it is formed by two atrium, by 2/3 by the left atrium and 1/3 by the right atrium. Okay, now what we can see in the base. We can see in the base, or it is also known as the posterior surface. In the base, you can see the openings of the four pulmonary veins, the superior opening of superior vena cava and the inferior vena cava. Okay, then the extension of the base at the vertebral level, if we say it in the vertebral level, it is from the 5th to 8th thoracic vertebra in our lying position. When we lie down, then the extension of the base is thoracic 5 to thoracic 8 vertebra. But when we are in erect position, then it descends about one vertebra, and it is then the extension is thoracic 6 to thoracic 9. Okay, this is the extension of the vertebra, and from the vertebra, the base is separated by the right pulmonary veins, the aorta, descending thoracic aorta, and esophagus. Okay, now the borders and surfaces. Okay, the borders. Heart bears the upper border, the inferior border, the left border, and the right border. Okay, this is the right border. At first, you see that this is more or less vertical and extends from the superior opening of the superior vena cava and up to the inferior vena cava. This is the right border, and it is fully formed by the right atrium. Okay, then the inferior border extends from the opening of the inferior vena cava. You see that this is the opening of inferior vena cava at this level. From this inferior vena cava opening up to the apex. Okay, up to the apex. You see that it is formed by mostly by the right ventricle and partly near the apex, partly by the left ventricle. Okay, now the left border extension from the left auricle up to the apex. This is the left border. This is the extension of the left border from the left auricle up to the apex. Okay, now the upper border, it is not well demarcated, and it is formed by the upper margin of the two atrium. This is the upper border, and it is not seen due to the presence of ascending aorta and the pulmonary trunk. Okay, now the surfaces of the heart. This is the anterior or sternocostal surface, and it is formed by the right ventricle, mostly by the right ventricle, 2/3. You can say the 2/3 by the right ventricle and 1/3 contribution from the left ventricle, and also from the right atrium and left auricle. But we cannot see, or the left atrium do not comes in the formation of the sternocostal surface or anterior surface. We cannot see the left atrium. Only the left auricle comes in the formation of the sternocostal surface. Okay, now the left surface. This is the left surface, and just below the left border and between the diaphragmatic surface, between left border and the diaphragmatic surface, there is a left surface. Okay, and it is formed by the left ventricle and partly by the left auricle. Okay, now the diaphragmatic surface or inferior surface, it is formed by the two ventricles, mostly by the left ventricle. The left 2/3 part by left ventricle and right 1/3 part by the right ventricle. Now I will talk to you about a point, that is the cracks of the heart. You see that the posterior part of the atrioventricular group and the posterior interventricular group and the interatrial group. Here is the interatrial group. The meeting points of these groups, the posterior part of atrioventricular group and the posterior interventricular group and interatrial group, this point is known as the crux of the heart. Okay, thank you.